In 3 months, the National Mental Health Commission will hand down its first report into the problems with the way authorities deal with the mentally ill. 2 Melbourne families understand the flaws in the system better than anyone. In both cases, their relatives were released from care without anybody being notified, and the consequences were devastating. Guy Stainer reports.
He was intelligent, he had a wonderful sense of humour, and when he was well, he was everybody's best friend. Who's this person here?
Jessie.
Yes.
It's Jessie.
Jessie Sangster is lovingly remembered as a man who enjoyed fishing and playing sport.
This is Jessie playing football.
Jessie, football.
But he also had his demons. He was diagnosed with bipolar disorder when he was 16.
Toward the end of his life, he was very intense and sometimes very scary to be around. Oftentimes he changed personalities.
In January 2010, Jessie Sangster was admitted as an involuntary patient at this hospital in Melbourne's East after being involved in a 6-hour standoff with police.
That was when I was told by Jessie's treating psychiatrist that it was time for me to go and get some respite. Jessie would be held in hospital for 6 weeks, at least, and then he would be placed in residential care.
Flat behind. Maddie.
Content her son was being looked after, Denise SANGSTER-GREENWOOD went to visit her daughter in Queensland. But instead of being in hospital for 6 weeks, Jessie Sangster was in hospital for just 6 days.
Are you surprised that Jessie was released?
Astounded.
No one told Jessie Sangster's mother and carer that he was being discharged. She'd rented the house next door just to keep her son close and safe. Now she was 2,000 kilometres away and Jessie was on his own.
The caseworker knew how unwell he was and wanted him hospitalised immediately. But she couldn't get through to the hospital and she couldn't get through to the psychiatrists.
Jessie Sangster self-harmed and called 000.
The 6 police officers and the 2 paramedics decided that Jessie wasn't actually mentally unwell, that he was drunk. So they left. And they left him, and an hour later he hopped in his car. And he died, just around the corner.
His car ran off the road in the foothills of the Dandenong Ranges. He was speeding and had a blood alcohol reading of 0.13. Jessie Sangster was 28.
I'd kept him alive for 12 years. I listened to them and I believed them when they said go and have some respite.
The Sangsters aren't the only ones who've been kept in the dark with tragic consequences.
Is that him there?
That's him there with the mullet. Yeah.
Mary MACQUEEN's son, Simon, had an ongoing battle with mental illness, hearing voices throughout his adult life.
When he finally went to hospital, we went into his unit and it was horrendous. He'd obviously tried to hang himself. There was no food, it was putrid. He was putrid when I took him to hospital.
On the 28th of November 2008, Simon MACQUEEN was discharged. No one told his family. His funeral was Christmas Eve.
All families who have lived with someone with a mental health condition know their child or whoever the family member is far better than anyone else. They know when they're ill and they know when they're suffering.
In an inquest into Jessie Sangster's death, the coroner recommended changes to Victoria's Mental Health Act to ensure families and carers are notified when involuntary patients are discharged. But that recommendation isn't new. An almost identical recommendation was made in New South Wales nearly a decade ago. If that recommendation had have been incorporated in Victoria, would Jessie still be alive today?
If Victoria had have followed New South Wales, Jessie wouldn't have died.
I think with coronial inquiries, the same mistakes are being captured and reported time after time, and no action is taken by state governments to address the failings of a very poorly resourced system.
About 20% of all coronial inquests deal with mental health patients, and the findings are often disturbingly similar case after case.
It's not difficult to implement them in theory. Getting them implemented at a practice level is sometimes quite challenging.
Rob Knowles is a former Victorian Health Minister and a member of the new National Mental Health Commission, designed to monitor and assess the system and provide policy advice to the federal government. He says notifying families of patient discharge is included in the National Mental Health Standards, but the standards aren't mandatory.
I can understand the frustration, but I think what it does highlight is that having established a framework doesn't always mean that it's reflected in the practice on the ground, and that's where I think we do need to try and find better ways of holding to account service delivery meeting the standards or the policy or the legal frameworks which are set out in the way in which they're meant to operate.
The National Mental Health Commission hands down its first report card on the system later this year. Coroners and thousands of families across the country will be watching with interest.
Changes have to be made so young people stop dying.
Guy Sainer reporting, and if you need help dealing with depression or mental illness, you can contact Lifeline or Beyond Blue on the numbers on the screen.